An outbreak of Ebola in Democratic Republic of Congo has alarmed experts with its late detection and quick spread. So what do we know about this strain of the disease, which has no vaccine? Ebola is a severe and often fatal virus that causes fever, body aches, vomiting, and diarrhea. It spreads through direct contact with bodily fluids of infected persons or contaminated materials. According to the World Health Organization, the average fatality rate is around 50%, varying from 25% to 90% in past outbreaks. This is Congo's 17th outbreak since the disease was first discovered in 1976. All but one of the previous outbreaks was the more common Zaire strain. This time, however, it's the Bundibujo strain, and that delayed detection of this outbreak, says Jean-Jacques Moyembe Tamfom.
The risk is very high that the next pandemic will start from the DRC. Our system is very weak at detecting an outbreak.
He was one of the co-discoverers of the disease half a century ago and is now Director General of Congo's National Institute for Biomedical Research.
They used the techniques we had used for the 2018 outbreak. And for that, we used a device called the Gene Expert, with specific cartridges for Ebola Zaire. And so, these Ebola Zaire cartridges did not recognize Ebola Bundibugyo.
The Bundibujo strain has no approved virus-specific therapeutics or vaccine. On Sunday, the World Health Organization declared this outbreak a public health emergency of international concern. That's because of the high risk the disease could spread further beyond Congo's borders. The outbreak is centered on the Ituri province of conflict-hit eastern Congo and is suspected to have already killed dozens of people. Cases have been confirmed in Kampala, the capital of neighboring Uganda. Reuters bureau chief for West and Central Africa, Robbie Corey-Boulay, said the situation has been complicated by conflict and cross-border trade in the area.
So there's people moving around, at all times across large distances, which will potentially, complicate any efforts to contain this and trace all of the potential cases.
The International Rescue Committee and Médecins Sans Frontières have said they're sending teams to respond to the outbreak. The WHO said additional supplies of protective equipment are being brought into the country. But on Sunday, Congo's health minister said a key tool to fight Ebola is vigilance. This is not a mystical disease, said Samuel Roger Kamba on a visit to Ituri's capital, Bunia. Make yourself known so that you can be taken care of and so that we can prevent the disease from spreading.